Good evening. Welcome to this edition of the 411 Talk Zone radio show. My name is Leon Jones. Tonight's topic, I'm just going to give you tips for lowering your blood pressure. Tips for lowering your blood pressure. Now, of course, blood pressure is also known as hypertension. But let's get on with the topic. Nearly 1 in 3 American adults has high blood pressure, and 2 in 3 people with diabetes report having blood pressure that is high or high blood pressure, or we can say hypertension, and they are taking prescription drugs to help lower blood pressure. Now, your heart has to work much harder when blood pressure is high, and this is where you get the risk for heart disease and strokes and other symptoms that come along with it. Now, when it comes to high blood pressure, it simply won't go away unless you treat it. So you must think about this because lifestyle changes have to be made. Now, when it comes to blood pressure, you hear the term every day, but do you really know what it is? And how is it measured? If you don't, I'm going to give you that information right now. Now, what blood pressure is, it's the force of blood flow inside your blood vessels. Your doctor records your blood pressure as 2 numbers, such as 120 divided by 80, or you hear the term 120 over 80. Now, both numbers are important. The first number is the pressure as your heart beats and pushes blood through the blood vessels. Healthcare providers call this systolic pressure. The second number is the pressure when vessels relax between heartbeats. It's called diastolic pressure. Now, here's where you're going to understand the numbers that are given to you by your doctor. And here's what they mean. When you have healthy or normal blood pressure, your reading must be below 120 over 80. Early high blood pressure is between 120 over 80 and 140 over 90. High blood pressure is 140 over 90 or higher. Let me translate it for you. You have normal blood pressure, you have prehypertension, first stage hypertension, and second stage hypertension. And you must know this, the lower your blood pressure, the better chances of delaying or preventing a heart attack or stroke. When your blood moves through your vessels with too much force, you have high blood pressure or hypertension. Your heart has to work harder when blood pressure is high, and your risk for heart disease and diabetes increases. High blood pressure raises your risk for heart attack, stroke, eye problems, and kidney disease. Again, I'm going to repeat this for you. High blood pressure is a problem that won't go away without treatment. So you're going to have to change your diet and your lifestyle. But how do you know if you have high blood pressure? You don't. Because high blood pressure is a silent problem. You won't know anything unless your healthcare provider checks your blood pressure. Have your blood pressure checked at least every regular healthcare visit, or at least once every 2 years if you're a person who doesn't have diabetes or any other risk for heart disease. Now, here are the tips that will help you reduce your high blood pressure. First, lower your cholesterol, get plenty of sleep, lower your stress level, and get plenty of exercise. Also, work with your healthcare provider to find a treatment plan that's right for you. Eat whole grain breads and cereals. Try herbs and spices instead of salt to flavor your foods. Check the food labels and choose foods with less than 400 milligrams of sodium per serving. Lose weight or take steps to prevent weight gain. Limit alcohol consumption, or if you want to drink alcohol, consult your healthcare provider to see if it's safe to drink any alcohol at all. Now, if you're a smoker, you got to quit, because not only will that lead to heart disease, it will also lead to lung cancer. Lastly, ask your healthcare provider about medications to help reduce blood pressure. Some of these sample types of medications are ACE inhibitors, ARBs, beta blockers, calcium channel blockers, and diuretics. And if you follow those steps, it will help you reduce your blood pressure, because high blood pressure, again, can lead to heart disease, strokes, and diabetes. And they're all silent killers as well. So if you follow the program that I've given you as a start, you can help yourself. And also consult with your doctor or healthcare professional and get more educated about high blood pressure. Because the more you know, you can also help somebody else who has high blood pressure. Because individuals are living longer, but you have a number of individuals who don't take care of themselves. And another point that I want to mention is check your family history. If you have a lot of heart disease, diabetes, and high blood pressure, because you can do everything correctly, but genetics means a lot as well. A number of us don't check what a number of our relatives passed from, but that's also important. So I just wanted to give you information on what you need to lower your blood pressure, and this information is basically an overview. There are more factors involved with hypertension, but I'm just giving you the basics right now. So just look at this video. If you like it, give me a thumbs up. If you don't, give me a thumbs down. But what I'm trying to do is just give you information that's going to help you. And that's my commentary for this edition of the 411 Talk Zone radio show for this evening, Tuesday, May 30th, 2017. You can tune into the 411 Talk Zone radio show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio. I'm going to talk about delusion and paranoia. You don't want to miss that show. The guest calling number is 215-383-5785. Of course, like I say in every video, if you like my videos, please share and subscribe to the 411 Talk Zone radio show right here on YouTube, so I can continue to give you quality information for educational purposes from a professional and mature perspective. Now, on this channel, I don't engage in debates, controversial issues, or emotional issues, nor do I participate in drama or unnecessary bickering. Why? Because it's counterproductive. My channel is an education channel. So what I do is keep everything realistic and positive, because it's very difficult to survive in the real world if you don't have any idea of how the system works. So I'm just giving you the tools so you can utilize them to change your way of thinking, because some people, they'll do something over and over and over and over again. It hasn't worked, but they're still looking for a different result. It doesn't happen. You got to change your mind. Open your mind up to new creativities and innovations. That's what you have to do. You got to stop being hard-headed, narcissistic, because information is powerful. That's it only if you're interested in it. Because again, this channel here, I don't promote drama or any of that nonsense. I promote education, because I'm here to educate myself and educate you, because we're supposed to learn from each other. That's how collaboration works. Again, knowledge is power. And if you have a topic, a business, or a new YouTube channel that you would like for me to discuss on YouTube or Blog Talk Radio, you can email me at lej6521@gmail.com. And if you have a comment, please leave your comment in the comment section under the video. but make sure that your comments are pithy. No bloviating, pettifogging, or filibustering if you wish to opine. Now that's it for this video. Till next time, my name is Leon Jones. Remember, please be gentle and respectful to each other and have a wonderful and blessed night. Good night.